Sickle cell is a chronic disease. We manage it. We are not yet curing it, but maybe we'll talk about cure later.
Yes.
So that means, like our warrior has said, and I really acknowledge and thank you for bringing out a lot of those stigma, because that's what keeps our patients or even our parents away from hospitals trying to seek help, because some of them are trying to hide and shelter their children because they don't want them to be labeled as a curse or to be told, why are you taking all these medications? So it's really brought out some of the misconceptions people have, even some of them thinking that it's contagious, and it's not, and not really understanding. Sometimes even teachers don't understand how painful that pain is, and some will say, I think your child is malingering. He doesn't want to go to school, or he doesn't want to play sports. And so we really have to raise awareness, and thank you for giving us that opportunity to do that, because sickle cell pain is real and nobody deserves to be. In fact, if you ask most patients with sickle cell, what's your most distressing symptom? They usually say, take care of my pain. All right? So basically the health risks of sickle cell disease, we can put them in two categories. There are those ones that will occur in the short term. We call them acute complications. Like, for example, the pain crisis, getting recurrent infections. And I'm glad he's talked about malaria, because if you look at the sickle cell map, sickle cell is largely an African disease. 90% of the patients who have sickle cell are actually found in Africa.
Is there a racial aspect to it in terms of the African or the darker tone race?
No, actually, it's really, I think, because of the geography of it and the environment. And what you'd find is that the sickle cell map and the malaria map are actually almost, you can superimpose them.
Wow.
And the reason, even in Kenya, you don't find sickle cell everywhere. You find it towards the lake region. You tend to find it also down at the coast, malaria dense zone. Because if you're a carrier of sickle cell, then you become immune, almost immune to malaria. So it's a way to adapt to that environment. But remember, carriers didn't have symptoms. So when they come together, they get a child with sickle cell, and most of the patients with sickle cell are very susceptible to getting malaria. So infections, malaria, getting anemia, those would be now the shorter term that you would see. But in the long run, if sickle cell is also not managed appropriately, and that is why it's so important for parents to seek help, because there's so much we can do for our children. You get chronic complications, the organs start changing. You start having changes in the brain, changes in the eyes, changes in the lung, changes in the heart, changes in the kidneys, changes in the bones, the vessels. So those long-term complications, we can avoid them. We can minimize them by giving them the appropriate therapy.
Now, are there